Welcome to The Explainer. Today, we're diving straight into a question that millions of people quietly ask themselves. How overweight is too overweight? For the longest time, carrying a little extra weight was just viewed as a cosmetic concern, wanting to fit into a certain pair of jeans. But modern medicine has drawn a very clear line in the sand. Obesity is actually a chronic disease, and it affects nearly every single organ system in your body. So let's break down the science and look at what's really happening beneath the surface, using a strictly evidence-based lens. And that brings us to a super common and completely valid question. I'm only a little overweight. Is that really a problem? The tricky thing about obesity is that it's absolutely not an overnight phenomenon. It's a gradual, silent disease. It can develop over years, sometimes decades, before you ever notice a single obvious symptom. So to really answer this question, we have to look way beyond just the total weight of your body. It all depends on how much fat you carry, exactly where that fat is being stored, and most importantly, how it's interacting with your internal biology. Here is our clinical roadmap for today. We're going to cover beyond the scale, the hidden danger of visceral fat, why weight loss is hard, the medical approach, and finally, redefining the real goal. All right, let's jump right into part one, beyond the scale, rethinking BMI. For decades, doctors leaned heavily on the body mass index, or BMI, as their go-to screening tool. You probably know the drill. If your score is 18.5 to 24.9, you're considered a healthy weight, 25 to 29.9 is overweight, and 30 or above crosses into obesity. But honestly, BMI has massive limitations because it literally only looks at your weight to height ratio. Think about it. You could have two people with the exact same BMI, but they might have vastly different body fat percentages and completely different health risks. That's why today's standard of care requires a much more comprehensive assessment. We're talking about evaluating body fat percentage, waist circumference, visceral fat, muscle mass, and your actual underlying metabolic health. So why does fat build up in the first place? Well, yes, overeating and a sedentary lifestyle play a role, but obesity is influenced by a massive, tangled web of complex biological factors. We are talking about genetics, hormonal changes, chronic stress, poor sleep quality, the natural aging process, certain medications, and insulin resistance. Emotional eating is a huge piece of the puzzle too. Because this condition is driven by so many overlapping biological processes, we really need to stop viewing it simply as a lack of willpower. It's so much more than that. Moving on to section 2, hidden danger, visceral fat, and why it's the silent threat. Here's the thing. Not all fat is created equal. First, you have subcutaneous fat. That's the fat located right beneath your skin. It's the stuff you can pinch. And while it might change your body shape or how you look in the mirror, medically speaking, it's generally less harmful. But then we have visceral fat. This is the fat that surrounds your vital internal organs, your liver, your pancreas, your intestines, your kidneys. And here's the kicker. Even people who look like they are only slightly overweight on the outside can actually be carrying dangerously high levels of this hidden visceral fat on the inside. And this visceral fat, it is not just inactive tissue taking up space. It actually acts like an endocrine organ. It is highly metabolically active, constantly producing hormones and pumping inflammatory chemicals directly into your bloodstream, which totally interferes with your body's normal functions. It is essentially a rogue organ, causing chronic inflammation. And that rogue organ triggers what medical professionals call the silent cascade. It's like a domino effect. As fat accumulation increases, your body becomes less responsive to insulin. Because of that, your blood sugar begins to rise. Then, your blood pressure often shoots up, your cholesterol levels get thrown out of whack, and your liver actually starts storing excess fat. This chronic inflammation just spreads throughout your entire body, completely driving up your risk for type 2 diabetes, heart disease, stroke, sleep apnea, and even certain cancers. And the absolute scariest part? These internal biological changes often happen silently for years before you ever notice a single symptom. Which brings us to section 3, why weight loss is hard, or as I like to call it, the biological pushback. We see it all the time. People successfully lose weight for a short bit, only to see it creep right back a few months later. Why does that happen? Well, it's because your body naturally wants to protect its energy stores. The very second you start losing weight, your biology fights back. The first thing that happens is your hunger hormones actively increase. Your body's literally sending these overpowering biochemical signals straight to your brain, demanding more calories. And the pushback definitely doesn't stop there. At the exact same time your hunger hormones are spiking, your fullness hormones actually decrease. So your appetite becomes much stronger, and it takes significantly more food for your brain to finally register that you're full. You are fighting a two-front chemical war. And then comes the final blow of the biological pushback. Your metabolism slows down. Your body shifts into this highly protective mode, meaning your whole fat-burning process becomes way less efficient. This specific triad, higher hunger, lower fullness, and a slower metabolism, is exactly why long-term weight management almost always requires so much more than just standard restrictive dieting. Because of this intense biological resistance, those traditional tactics people try usually backfire. Skipping meals, going on wild crash diets, doing hours of excessive cardio while completely ignoring strength training, or trying to cut calories while ignoring poor sleep and chronic stress. Sustainable weight management involves so much more than just eating less. Those common mistakes often just result in you losing precious muscle mass instead of fat, which ironically makes long-term success that much harder. But hey, here is the clinical silver lining, and it's a wonderfully powerful number: 5 to 10%. Research clearly shows that you absolutely do not need to lose all of your excess weight to see massive health benefits. Losing just 5 to 10% of your total body weight can significantly improve your blood sugar, lower your blood pressure, balance your cholesterol levels, and dramatically improve your overall metabolic health. Small changes really do yield massive biological returns. Let's look at how to tackle this in Section 4, the medical approach. Treating the root cause. Effective weight management requires a structured, evidence-based game plan. It starts with a comprehensive assessment of your unique biology. Step 2 is analyzing the root cause, basically figuring out exactly why your body is storing that fat in the first place. Step 3 is building a solid foundation of lifestyle modifications, things like balanced nutrition, sleep quality, and stress management. And finally, Step 4 involves physician-supervised medical interventions when appropriate, giving you the actual clinical support you need to manage your weight safely. To put this medical approach into perspective, let's look at a structured facility like Topform Clinic. They focus purely on identifying those underlying causes to build highly individualized treatment plans. This means they do precise body composition analysis, specialized visceral fat evaluations, and offer personalized nutrition guidance. By combining lifestyle counseling with active medical weight management and physician consultations, they make sure every single plan is designed specifically for an individual's unique health status and long-term goals. Finally, we arrive at Section 5, redefining the real goal, focusing on health, not just weight. So what should you actually be aiming for here? A healthy weight is definitely not about becoming as thin as humanly possible. The true goal is to reduce excess inflammatory body fat, especially that dangerous visceral fat we talked about. It's about improving your metabolic health, definitively lowering your risk for chronic diseases, increasing your daily energy levels, and ultimately protecting your long-term health and quality of life. Remember, it's those small, consistent changes that lead to these huge, significant improvements over time. Which leaves us with a pretty big question to chew on. We now know that obesity is a complex, treatable medical condition. It's driven by biology, not a lack of willpower. You've seen the hidden dangers, you understand the biological pushback, and you know there is a structured medical path forward. So are you ready to stop fighting your biology all by yourself, treat obesity as the medical condition it truly is, and take that first step toward lasting health? Thanks for joining me on this explainer, and as always, keep learning.